So I'm Norah Khaldi. I'm the founder of Neuratas. So Neuratas is a company that combines three different areas: artificial intelligence, food, and health, to identify new active ingredients that are going to promote health in billions of people around the world.
Okay. And you're based in?
We're based in Dublin, in Ireland.
You told us that there is hardly any innovation in food.
Yeah, so the food industry suffers from a lot of problems, one of which is that for many years the goal of the food industry was to enhance taste and reduce costs. And because of that, innovation in it didn't really take off. Science is not important really. It's all about how can we really reduce sugar and how can we reduce fats. And really innovation is all about, all about this. How can we enhance texture of a product and change a color of a product? But really the true potential of using molecules in food to prevent disease from happening is currently impossible because of the lack of science in that area.
No scientists are working on that subject.
Well, very, very few there are. Very, very few. They're the really, like, when you see it on the shelves, you basically see it everyday shelves, and when you go into the supermarket, it's all about sugar-free, fat-free, and it's all about that. And this is problematic because it has caused the biggest problems in society, like obesity, metabolic syndromes correlate very clearly with the rise in sugar-free and fat-free. So it's even causing more trouble than solutions.
And what do you do differently?
So what we're bringing is a whole new technology. So the food area in general, or the health area, it's even bigger than food. It's not about food really, it's the health area. So the health area in general is hitting a wall. We can cure disease, but we cannot prevent it. And what we're bringing is a new way of very quickly assessing foods to discover molecules that can prevent disease from happening. So every food has trillions of molecules, and over 200,000 years of us as a human race, we have not used that potential. So currently, by using artificial intelligence, we're capable of looking at every molecule in every food, understanding how that molecule binds to the human body and modulates a disease. And doing that, we can then identify the best candidates and create food ingredients that are going to transform health by extending humans' health period and by reducing disease. And the food companies cannot do this because so far to find these molecules it takes years and millions, and food companies cannot pay for that. It's too expensive.
You discovered it by studying milk.
So that's a good question. So I work in the area of drug discovery for quite a long time, but then I started working in milk, and this is how I found the potential in food.
What did you find?
So discovered some great ingredients in food called peptides that modulate, for example, insulin secretion, that modulate very specifically, that reduce blood pressure, that kill very specific bacteria. And all these are found in milk, the milk we drink every single day, that we don't really even think about it, but obviously if you drink the milk itself, you don't really get the total benefit. It's by us finding that molecule and releasing it from the milk structure that it becomes active.
And you said the innovations, the studying of all the meaning of food is too expensive. Is that what you said?
Yeah. So one of the examples I give in my talk is that if you think about it, to understand any food, you have trillions of molecules, and then you have trillions of receptors, so locks, and you need to combine both. So you're trying to find the molecules in food that are going to bind to receptors in the human body and modulate them. So to do that, it takes hundreds of millions, it takes a lot of scientific expertise, and it takes a lot of years. And food industry cannot put in the money and the time to develop such things. That's where the need for new technology comes in, and this is where we're using artificial intelligence to speed up that discovery rate and to be more accurate. So when we choose a key, we know that the key is going to open that lock specifically with a higher probability.
And pharma doesn't have a clue.
So pharma are great. So pharma are creating some amazing drugs, etc. But the problem with pharma is that they don't really understand food, and they don't see the potential of food, because obviously food was misrepresented to us and as a human race for 200,000 years. But the major problem in pharma is the lack in their pipeline. They have a drying up pipeline of new products. They're looking for new products. They've used their space. They've found everything they could nearly find. Now they're looking for new molecules, new combinations. And by us digging in deep into food and identifying new combinations, we can offer them a whole series of a new pipeline, basically, for new drug generation.
So the food science is the new pharma?
I guess so. I think both are tightly linked. Yeah, definitely. I think it's a good thing. I think then that's what we're doing. We're bringing together health, which is more about, again, I don't want to say pharma, but general than pharma, more general than pharma. It's health, food, and AI. So we're bringing those together to accelerate the discovery of these actives are going to be used in the preventative measure and also in the disease when you get it. Like, one of the things that I find mad is that 97% of government expenditures around the world goes towards curing disease when you get it, and only 3% towards prevention, and should be the opposite. They should be trying to
How much could you change it? How can you shift the percentages?
It should be at least 50-50. And the reason why it's only 3% is because there's no solution out there for prevention. And we need new ingredients to help prevent, but there's none. So by us identifying them quickly, we make them cost effectively. We can make now cost effective ingredients that can be added to food, that food can afford to put in their products. So prevention is thus solved.
Okay. And what does it need to make that shift to 50-50?
Well, I think there should be, governments should realise, they are realising that they can't sustain such an expenditure of 97% on disease. There's a huge growing population, the ageing population is growing, and there's, sustaining curing a disease for years and years is too expensive. So there's a huge pressure on them to find new solutions. A new solution is very scientifically proven ingredients that are going to prevent that disease from happening. So there shouldn't be any problem from them to actually start investing into prevention and growing that area. But real scientific prevention, not just this mixture is good for you, but really this mixture is good for you because it has this ingredient that specifically binds to this receptor, scientifically proven, to reduce that case. So that's what they should be investing in more, to reduce that gap between curing a disease which is unsustainable and taking it and prevention.
Thank you very much, Norah Khaldi.
Thanks.